Hey guys, it's Dr. Ndidi here, and today we're going to be talking about the signs and symptoms of PCOS. How do you know you have PCOS, which is Polycystic Ovary Syndrome? If you want to find out, stay tuned. So you have been asking and wondering, I've heard a lot about PCOS. How do I know that I have it? Polycystic Ovary Syndrome, which is also PCOS, affects 2 in every 10 women. And most women walk around, they don't know that they have PCOS, except you know these things to look out for. So some of the problems with PCOS really affects women in regards to how they look physically, which most of the symptoms, that's what it is, how they look physically. So we're talking about growing facial hair or just hair in places you don't care for, like your chest, or extremely hairy arms or legs. That could be a sign of PCOS. Now keep in mind, all of these things I'm gonna mention today, they don't happen individually and you say you have PCOS. They actually have to occur together. Either you have all of them happening at the same time or quite a few of them happening at the same time for you to know that, okay, yes, I do have polycystic ovary syndrome. Also, you might be experiencing baldness at the crown of your head. So if you see that you're losing a lot of hair, there's a lot of hair thinning going on, alopecia, that could also be a sign. Now, severe cystic acne could be part of the problem, which is something that I suffered for about 15 years. And I couldn't really figure out why I was having that issue. I was seeing a lot of dermatologists. I was using a lot of products to clear my skin. And then after clearing my skin, then I'm trying to clear the hyperpigmentation, the scars that were left behind after the acne or the pimples had gone away. So it was a constant cycle because as I'm breaking out, I'm having scars and I'm treating those scars and I'm breaking out again. Those acnes were sometimes very huge. Most times they were extremely big, very deep seated in my skin. That is what cystic acne is. It's not just the ones that are superficial that appear on the top of your skin and you just, if you like popping and you move on. The cystic acnes were like deep into deeper layers of your skin. Sometimes it could be because of just the facial hair you're having, right? The hair grows back into your skin and they call that ingrown hair, and it irritates your skin so much that it causes the acne to be so huge and so big. So I went through a lot of that. Sometimes the acne would move to my forehead, my jaw, my chin line, my cheeks it was especially on one side of my face than the other. Sometimes it moves to the rest of your body. I've seen people who suffer with the cystic acne on their back, or their chest, and everybody's just different. So severe cystic acne is one of the symptoms and signs of polycystic ovary syndrome. Now, let's talk about weight. Weight issues with PCOS is very prevalent. People will say they are working out or they're eating healthy, but nothing is happening. And this is just because most people start suffering from insulin resistance, which is where your insulin is not working properly anymore. Every time you eat, your body is supposed to carry the food into different cells and organs that need them. But when your insulin is not working, then what happens is everything stays still. And so you have a high blood level of sugars, you have a high blood level of fats and oils and things like that, because your body is not working properly to transition those items into the cells that need them. So now you're having problems with weight gain because you keep gaining weight and everything stays in your bloodstream because insulin is not working properly. And insulin and testosterone, they kind of go hand in hand. So where you have insulin not working and it's just staying in your bloodstream, testosterone or androgens are somewhere around the corner doing the same thing. And then you're going to express those symptoms I already mentioned. Another sign and symptom of PCOS will be fertility issues. So either maybe you're getting pregnant, but it's ending up in a lot of miscarriages, or that's multiple miscarriages that you've had, or you're just not getting pregnant at all. This points down to their menstrual cycle or ovulation. So essentially, either you're on your period for a long time. I've seen people tell me they've been on their period for like 3 months. I'm like, what? And it's not like little spot, and it's like actually a whole heavy flow. I've seen people say, it's 3 weeks they've been on their period. And when that happens, you can't predict your ovulation, because when you're supposed to be ovulating, based off of the first day when you have your period, it's supposed to happen around in the windows of 11 to 15 days, right? But then if you're still on your period on those days, how do you now determine if you're really ovulating? Because the blood needs to stop bleeding so that the wall can get thicker, and that's how it holds the sperm, and then you get pregnant. But if you're shedding blood the whole time, then the wall is not thick enough for you to be able to get pregnant. So that's why it's really important for people to be able to predict when they're ovulating and try for a baby. But if you have no period at all, the people also that go months, years without having a period and there's no explained reason, right, from their regular doctor, or they're just bleeding a whole lot and it's very heavy, and it could be coming with extreme severe cramps. Like I suffered from severe cramps, like rolling on the floor, throwing up, like that kind of cramp. It got to the point where my body was so tolerant of just over-the-counter meds that when I took them, even like I would take 4 tablets at once. At one point, nothing was working, right? Because it built up so much tolerance. So I had to be in this severe pain and just deal with it. Now, another sign and symptom that you could tell if you have PCOS is you would actually have to go for an ultrasound, and they would have to scan your ovaries and things like that to determine if you do have any kind of cyst growing on your ovaries. Now, keep in mind that in this case with the cyst, just because you have cysts growing on your ovaries doesn't mean that you have PCOS. And just because you don't have any cysts on your ovaries doesn't mean you don't have PCOS. Like I said, everything occurs at the same time. With the cyst, it only occurs if you go to your doctor and they actually do an ultrasound. You can't really tell what's going on inside your body without somebody else looking and trying to see if they could find cysts. So just keep that in mind. You'd have to probably make a doctor's appointment, go in, and they have to do an ultrasound on your ovaries. Another way that is not really physical, but is doing blood work. They do a blood work to see what your hormonal levels are. Hormonal imbalance is very common in PCOS. And so they're trying to see where your testosterone levels are, your estrogen levels are, your luteinizing hormones, what levels they are, and your follicular stimulating hormones, which is FSH. So those have to be balanced. If they're not, if one is over the other, if you have more testosterone, if your LH and FSH are not balanced, normally they're supposed to be 1-to-1, but if one is over the other, then that is a sign of hormonal imbalance. And when that happens, you're going to have a plethora of all these things occurring at the same time. But the one with the blood test, again, you'd have to make an appointment with a technician that does the blood work, or your doctor's office, to see how they could pull your blood to test for your hormones. So those are ways you could tell if you have PCOS or not. Some of the other ones will be like also suffering from anxiety and depression. And this just comes because the other symptoms and signs are very telling and they're very physical, and people don't like the way they look when they're going through that. And people don't like the fact that, you know, maybe they've been trying to have a baby and they're not able to. They don't like the way they look when they wear their clothes anymore. So those are reasons why it might come with anxiety and depression. So knowing if you have PCOS or polycystic ovary syndrome is very important so that you can take care of it now, so it doesn't lead to other things further on, because this could be passed down to your female children. It could also lead to other problems in the future if you don't take care of it now, like diabetes, heart issues, high blood pressure, even uterine cancer. You don't want complications with when it comes time to be able to conceive a child, where you're now dealing with infertility. So these are the reasons why you need to know what all these things I mentioned. If you have a few of them, you need to know if it's PCOS you're dealing with, and then you need to learn how to reverse it, which is what I help people do. Now, if you like any of the information I just provided today, go ahead and give this video a thumbs up. Make sure you subscribe and let other people know, like, hey, this is something that I didn't know. I have all the symptoms and I didn't know the name was called PCOS. Comment and let me know. And if you need my help, definitely comment and I will reach back out to you. In the meantime, thank you for staying tuned, and I will see you again later. Take care.